Hi Mary, what's up?
Nothing much. As a matter of fact, I'm fine.
But you don't look like you are fine to me. I have been observing you and you looks like someone who is suffering from depression.
What is depression?
Well, according to Lane C. 2013, depression is a mood, a persistent feeling of sadness and loss of interest. It affects how you feel, think and behave and can lead to a variety of emotional and physical problems.
So this depression you talking about, what caused it?
You know there are different causes. You have 1. Biological chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. When these chemicals are out of balance, it may lead to depression symptoms. 2. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. 3. Inherited traits. Depression is more common in people whose biological blood relatives also have the condition. 4. Early childhood trauma. Traumatic events during childhood, such as physical or emotional abuse, or loss of a parent, may cause changes in the brain that make a person more susceptible to depression. 5. Learned patterns of negative thinking. Teen depression may be linked to learning to feel helpless, rather than learning to feel capable of finding solutions for life's challenges.
Well, I can tell you I'm fine anyway.
That is what you think, because I have noticed that you are displaying some symptoms.
True. So what are the symptoms?
These symptoms are feelings of sadness, which can include crying spells for no apparent reason, irritability, frustration or a feeling of anger, even over small matters, loss of interest or pleasure in normal activities, loss of interest in, or conflict with, family and friends, feelings of worthlessness, guilt, fixation on past failures or exaggerated self-blame or self-criticism, extreme sensitivity to rejection or failure, and the need for excessive reassurance, trouble thinking, concentrating, making decisions, and remembering things. Ongoing sense that life and the future are grim and bleak. Tiredness and loss of energy, insomnia or sleeping too much, changes in appetite, such as decreased appetite and weight loss, or increased craving for food and weight gain, slowed thinking, speaking or body movements. Poor school performance or frequent absences from school, neglected appearance, such as mismatched clothes and unkempt hair. Disruptive or risky behavior.
Is it that obvious? Because I am really feeling some of those symptoms you just told me. Is there treatment for this?
Of course there is treatment. There are treatments such as, in some cases, a primary care doctor can prescribe medications that relieve depression symptoms. However, many teens need to see a psychiatrist or a psychologist or other mental health counselors. Psychotherapy, also called psychological counseling or talk therapy, is a general term for treating depression by talking about depression issues with a mental health provider.
Thanks for your advice and concerns, John, but I have to run now.
Hope she took my advice and get some treatment for her depression symptoms.